Hi, I'm Patty Malloy, Mahaska County Public Health Coordinator.
Hi, I'm Denyse Gipple. I'm the Population Health and Quality Director here at Mahaska Health. I'm responsible for infection prevention, and I work with Patty in public health.
We're here today to just kind of review some things that we know the public is probably interested in. One of the things is the recent cases that we've had here in Mahaska County. We currently have 2 cases of COVID-19 here in Mahaska County.
So we know that you have a lot of questions about what is going on and how we're managing things here at the hospital. We are doing testing on patients that meet criteria through the state hygienic laboratory. The current criteria is that we'll test any hospitalized patient that has a fever and respiratory illness. We also are able to test adults who are over 60 years of age who have chronic medical conditions and have a fever and respiratory illness, such as cough, difficulty breathing. Chronic medical conditions, in case you're wondering, would be diabetes, heart disease, or being on an immune suppressive medication. Ask your doctor if you have questions about what that would be. Also, we're able to test people who have fever or respiratory symptoms who live in a congregate setting. So people who would live in dormitories or long-term care settings, we're able to run tests there. And then the last criteria is healthcare workers and essential services personnel. So we would have first responders with fever and respiratory symptoms are eligible for testing. So we do have a drive-through screening system right now. So you can follow the directions as you drive up to our campus from the C Avenue East entrance. There will be tents in front of door 2, which is the 1929 building. We have clinical staff out there who can take temperatures and ask you what you're here for and send you to the right place. If you do have respiratory symptoms or GI symptoms that could indicate COVID-19, then we would send you to door 1 to be seen by a provider and take care of your issues there. Otherwise, you could be redirected to door 4. Or also door 5 is available for emergencies as always.
So with the cases that we have identified here in Mahaska County, we still are encouraging all residents to continue to make prevention a priority. So like Denyse said, the social distancing is something that we still want to make a priority here, and washing your hands, covering your cough symptoms. We've said this numerous times, but a cough, fever, shortness of breath, GI symptoms, and staying home when you're ill. That's really important. We just want to make sure that if you're ill and you have those symptoms, that you're self-isolating at home. Self-isolating in a sick space in your home is important also to keep the people in your home well as well. So some things that keep you from preventing the disease is you have no fever for at least 72 hours without fever-reducing medication, and other symptoms have improved. For example, when your cough, shortness of breath, or fever have resolved, and at least 7 days have passed since your symptoms first appeared. This information is on the Iowa Department of Public Health website for your information, because it's not just one of those things I mentioned, it's all of them would allow you to be out in the community.
And another question that we've had frequently is, to stay well, should you wear a mask in public? And we're asking right now that you help us conserve masks and things like that for the caregivers who really need it and for our sick patients. It's not shown that wearing a mask in public will help you prevent the spread of disease. It's really that social distancing, staying home, covering your cough, sanitizing surfaces frequently. Those are the things that we continue to talk about. So we also have had some questions about what plans we have in place and what those tents are doing outside our building. So just to kind of address that, we have a very good relationship with our partners in this community. Jamie Robinson at the Emergency Management Agency in Mahaska County has been very helpful, and we wanted to make sure we had the supplies and the space needed before it became an issue. So we do have a tent and a mobile building that we could possibly use for different services. So I'm not sure at this point what that will look like, and we'll be getting information out to the public when we figure that out. But at times like these, we prepare for a surge in patients. We want to make sure that we can be here to serve the Mahaska community.
And I want to thank the community, because we've seen lots of good things happening, here around the hospital and out in the community for people following the recommendations that we've provided, and we just thank you all for doing that, because that's really what's going to help keep this at bay and help us from being where we can't handle the surge. Thank you.